came here to testify about the need to continue to fund prevention efforts, specifically funding of prevention around, I want to look at this. Okay, funding prevention around tobacco, chronic disease prevention, and funding for prevention of infectious disease programs. Wisconsin is 41st in funding of prevention, so where the national average is about $39 per capita, funding in Wisconsin is about $15 per capita. So we are very under-resourced when it comes to public health funding. So if we're going to kind of save on healthcare costs, there's been a lot of good research that shows that if you fund prevention, you save on healthcare costs down the road. So I was here to advocate for funding tobacco prevention, because tobacco, it might not be as sexy as opiates and opioid prevention, which gets all the media coverage because we've seen this surge in cases and deaths associated with opiates. But tobacco has been killing people for decades. The CDC estimates 1 in 5 deaths can be attributed to tobacco use. But we can't let up, and we have to still continue to fund tobacco prevention programs like the City of Milwaukee Tobacco Free Alliance, which teaches youth about tobacco with their FACT program. There's the Wisconsin Quit Line that helps connect people with quitting resources, which is much more successful than people trying to quit cold turkey on their own. The other thing that I came to here to really advocate for is for dedicated funding for local health departments for infectious disease response. It really falls on local health departments to investigate cases of communicable disease. In order to do that, we need a robust surveillance system where we go out and we detect cases of communicable disease. We try to investigate their sources. We track down contacts and make sure that they get appropriately treated, and we make sure that they don't infect other people, so we can kind of stop them early and prevent their spread, which is much more effective than waiting to have lots of cases. And with this kind of world that we live in, when you're just like a plane ride away from the next big outbreak, it's important to have a robust disease detection and investigation system. So the Wisconsin Public Health Association has been drawn up and trying to work with the Wisconsin legislature to get dedicated public health funding. They've made the ask for $2.5 million per year for our local health departments to kind of help fund that effort. It's really kind of been hard for local public health to get dedicated funding when we're kind of competing with police and fire for kind of a diminishing part of city budgets.